Hey guys, Heath and Laura here. Hey, we were approached by the church family wanting to know if we could answer a few medical questions regarding our community and what we're seeing here. So we thought we'd take this chance and see what we can answer, see if we can maybe make this a weekly little local medical vlog, us answering your questions and kind of the current state of the coronavirus, what we call the COVID-19, what we're seeing, how it's affecting us, and maybe some tips and pointers for you guys. So Laura, you want to start with the first question?
We had several questions that were asked, and they just wanted to kind of get some information that we could pass along to you guys. And the first question that we had was, what have you seen and what is the current situation here in Dadeville?
Well, our views are pretty similar, a little different. Most of all of my time is spent in the ER. Laura's got her own family medicine practice, but we are both working as a hospitalist on a COVID positive floor. What a hospitalist is kind of the one person that looks over all the patients that are admitted to the hospital. All of these patients are COVID positives. We kind of review everything that is going on with them, change treatments as they need to be changed. But in the ER, what we're seeing, actually recently, we're seeing a little bit of an incline or an increase in the number of people that we're testing, as well as the number of positives that are coming back. Now, we're trying to make this completely an unbiased little interview. I think it has nothing to do with the economy reopening or anything. I think it's just getting to some of the rural communities more. We've seen all the news on the big cities, New York, New Orleans, Miami, out in California, certainly. A lot different geographic area, a lot different population. So yes, we are seeing it here. More people presenting to the ER with symptoms. The testing, we are testing more than we were initially, which probably is part of the result in getting more of the positives back as well. But we certainly, I don't know about the clinic, but ER certainly we're seeing more.
Yeah, I agree. We are seeing more. We actually tested more this past week than we have tested in several weeks, and we've been testing since the very first day. And it's just been a little bit more of an incline in testing and positives that we're receiving. So I would agree with that. We are seeing an incline in our testing.
All right. So second question we have here, it was, when can we expect to get testing available in our community? Well, that's a great question because early on, testing was very limited. We had very strict protocols on who to test. The state actually had set up this website. We had to go into the website, put in all the patient information, and they would tell you immediately whether, yes, this patient qualified for testing and you needed to test them, or no, this patient did not qualify for testing. And in that case, we would send them home with the home quarantine isolation precautions while they were having symptoms, certainly to call us back if there was anything there. But testing has become much more available. We've been able to test many more people, but our testing still is not the testing that is for the person who just wants to know if they have it, or the person that wants to know if they have had it. Our testing is still reserved for those that come to either the clinic or the ER that are sick, those that have the cough, those that have the fever, those that have the shortness of breath, pneumonia, all these other factors that can go with it. Those are the ones we are testing. Go ahead.
Well, we did get a little bit of release from the CDC and the Alabama Department of Public Health. They are allowing us to test people who have been exposed, say in a work environment or in if they are a healthcare provider or a sitter, we are actually able to test those people. It is easier to get those done, but we still are trying. We're limited on our testing. That's our problem. And we still do try to reserve those for people who are symptomatic or really have been exposed firsthand, not secondary, but firsthand, person to person. We will test those people. But yes, we are not a site where you can just get tested because you want to get tested with no symptoms. But there are some out there.
Right.
There's a website where you can find those locations. The closest location to us is at Main Street Urgent Care in Alex City across from Walmart. I think there's one in Wetumpka. I'm sure there's probably some in Opelika, Auburn area, Montgomery, but our closest is the Main Street in Alex City.
And they are doing both types of testing. The test to see if you have the COVID currently is a nasal swab, quite uncomfortable. But they also do have the antibody test, which is a blood draw test, which shows if you have had COVID recently over the past few months.
Yes. We're moving on to our third question. What is your current recommendation for us? I guess as in the church.
Yep. I would think just common sense. We have learned a lot about this COVID virus over the last several months. Still a lot to be learned about it, of course. But working firsthand, not only us, but all the nurses, the doctors, the nursing assistants, the caretakers, dietary. We have so many people that come in direct contact with these people. We've kind of learned, I guess, a lot about our safety that we can roll to you as far as your safety. First and foremost, with anything, any virus, any bacteria, any problem, is washing your hands. That is by far the number one thing to do to prevent sickness and illness. Always has been, always will be. Hand sanitizer is great, as long as it's a good sanitizer, not one that's made with who knows what, and they're out there. We recommend the ones that are made with at least 60% or more of an alcohol base. But still, it does not replace washing your hands. Washing your hands is still the number one thing above all else. Two, going back to common sense, avoid those people that are sick. If they're coughing and they're sneezing, don't be around them. Certainly, unfortunately, this virus is one of the many viruses that can be infectious or contagious from a person who has no symptoms. I get in trouble a lot, but I believe
he thinks everyone has it.
Everybody has it.
Yes.
And I want everybody to think that I have it as well. That's just the simplest way in my mind to keep myself and our family safe, as well as to keep you safe. So I'm doing the distancing. I don't count 6 feet or 6 tiles. I don't care about that. I'm just not going to be right in your face. I'll wave to you instead of shake your hand. We can have a conversation, and I feel completely comfortable having a conversation a couple of feet apart, as long as I'm not coughing, you're not sneezing, and should be no issues. We wash surfaces or decontaminate surfaces that are touched every day. In a church, you think about doorknobs, of course, telephones, toilet seats, toilet handles. This is a virus that can potentially be infectious through the bathroom. Sinks, water faucets, things like that. We have to be a little bit more diligent in washing, cleaning, decontaminating. But other than that, a little space. Avoid those that are sick. Don't be right in somebody's face. If you have to cough or you have to sneeze, turn away from people. Cough into your shirt, cough into your arm, and just kind of common sense. Wash your hands more times than you think you need to.
Absolutely.
Number 4. So, do you have the equipment that you need, such as PPE, which is personal protective equipment, or ventilators? Yep.
Well, unfortunately, we are a rural hospital, and we are the kind of low man on totem pole with that situation. So all of the bigger facilities, do typically get a larger amount of equipment than what we have, and we have struggled a little bit with things such as N95 masks, gowns. But as of right now, we do have equipment, and we are trying to use it sparingly, and we will reuse it as much as we possibly can, feeling safely about that. We will say we go in and we see our patients for the day. We will use that gown that entire day. And the same N95 respirator mask. We actually double layer our mask. So we wear our N95 up under a regular surgical or cloth mask so we can protect those N95s and make them last a little longer. We have gloves, we have shoe covers, we have caps. So as of right now, we are okay on equipment. It's just limited, and we are trying to use it sparingly.
Yeah, and as far as ventilators, being a rural community hospital, we have no ventilators at the hospital at all. We have no respiratory therapists, which are generally the people in a hospital that are trained to help set the vents up. We have no anesthesiologists, which are experts at handling somebody's airway and breathing. So the patients we keep are generally those that at the time do not need to be on a ventilator. And if we have a patient that comes in, or a patient, their health decreases to the point that they do need a ventilator, we try to transfer those to bigger facilities around us. Of course, without the COVID, most hospitals work at 80 to 90% capacity anyway. And now that we added a new unknown virus, the COVID, the hospitals are at 100%. So it makes transfer a little bit difficult sometimes, but we make do. We're doing pretty well, and I think we're getting a handle on this. So next question, are masks really useful? You want it?
Sure. Yes, we do believe that masks are very useful, and they do protect you to a certain extent as far as from droplets, and if people are coughing or sneezing, as long as you are wearing it correctly, which is over the nose and the mouth, yes, they can protect you. Now, if you were in a situation like we were, where we were testing someone or examining someone very closely and they were in our face, then no, not the typical masks are going to protect you. N95s are the only mask that will protect you from those type of viruses, such as corona or tuberculosis. But yes, if you are out and about and you're going to be in an area where there may be people close to you or in your space, then yes, a mask is definitely a barrier that can help protect you and protect someone else. And we've seen a lot of people wearing masks, and I think it's wonderful. It actually could do a lot of good if people would continue to practice that. And we appreciate that, because that not only protects patients, but it protects us as well, and yourself and your family. So yes, I think masks are very useful, and I think it's something that we do ourselves, and
Right.
I would suggest that everyone do.
Yeah, one thing about, she mentioned the N95 particulate respirator masks. They're the ones that really stop the most bacteria, viruses, up to 95% of all known viruses, only if they're used correctly. We have to go through, all healthcare providers have to go through rigorous fit testing for these masks. So it's not necessarily the same as going out to Home Depot or Lowe's or wherever else you see an N95 mask, because some of these places do sell those. A little bit different. Material is the same, still excellent at stopping any particles, but the fit is the key. They have to fit closely. She mentioned over the nose and the mouth. We do see a lot of people out there wearing the mask, which is great, but they're pulling it down to talk to somebody this close, or they're constantly moving it. And your hands, you go in a grocery store and you're touching the buggies, you're touching whatever, the bathroom door, the meat counter, and you're pulling your mask the whole time. So whatever germs you have on your hand, you're actually getting them closer to your face, mouth, and nose by continually touching your mask. That's something that comes with time. It's difficult for medical professionals not to touch our face. It's like my nose never itches until my mask is on. But that's something you have to pay attention to if you do wear a mask. Next question, number 6.
What precautions do we need to take?
Kind of goes back to what we were mentioning earlier about current recommendations. Just the social distancing thing is great. We really do, as medical professionals, feel that we have flattened the curve. Flatten the curve does not mean that you or I am not going to get this virus. What it means is that the entire community did not get this virus at one time, which would have completely overwhelmed all medical facilities in Alabama. What this has done by social distancing is giving us time to treat the acutely ill, get them well and discharged before the next set of people come in. It kind of gives us a curve to work with. But, the precautions and recommendations, washing your hands, keeping that space, use hand sanitizer when you can't wash your hands. Wear a mask if you feel comfortable. I know a lot of people say, I'm not going to wear a mask. I respect that. That's completely fine. We don't wear a mask every day. If I'm going into this store and I scope it out and there's not a lot of people in there, I can get in and get out, I may not wear a mask. But if I'm going into a crowded store, I'm going to wear it. That's just my personal feeling. Like I said, I want people to think that I'm infected or I act like other people are infected, simply to limit any exposure just in case one of us are.
Yep. I agree with that. Our whole family has masks. My mom and dad have masks. We have really pushed that. So we do think that is a big part of this and really kind of keeping this curve down. But simple things like your space, you're 6 feet apart. Your hand washing is just number one. I know we've seen people or had people say, hey, I go to the grocery store and I spray every one of my groceries down before I bring them into the house. And I don't necessarily think that is necessary. We don't do that here. But we do wash our hands after handling those things, after getting out of the grocery store, after, anything like that, we do wash, and I think that's the number one thing you can do at this point is just wash every time you think about it.
Yeah. Now, number 7 question is a great one, especially for our county. It is, what's the current information from the Elliott City Veterans Home, Chapman's Nursing Home, Dayville Healthcare? Are there any on ventilators? Well, we're prohibited from saying too much about any one patient. I will tell you this, Tallapoosa County as a whole has a tremendous number of patients or nursing home residents. Several nursing homes, not even listed in this list, are in Tallapoosa County. You think about these people, they're in a nursing home for a reason. It's not because, unfortunately, they're good and healthy and productive people. These people are sick. These people need more help than some families can provide to continue their life. They have multiple comorbidities, which is multiple health problems. Some are cancer, some are Alzheimer's, dementia, some, just some of these horrible, horrible diseases that we get as we age. So a lot of these are very frail, very, very elderly people. And as I mentioned before, unfortunately, this virus is a virus that can be transmitted through asymptomatic people with no symptoms at all. So you may they could have had family members, they could have had workers, employees that were exposed or positive and did not know that, and go in to work with these people and was able to transmit or spread this virus person to person. And I'm telling you, what we have seen globally is any tight, packed place. It doesn't have to be a nursing home. It can be a city, a large population, but you get a lot of people together. You get a few people that are exposed and positive. That just explodes very quickly. to multiple positive cases. That's what we've seen around in some of the nursing homes. Despite their best efforts, they are doing everything we are doing. They're doing isolation, they're doing containment, but it gets out. The personal protective equipment we wear, there's a certain way you have to put it on, certain way you have to take it off. This is training we get frequently over and over and over. It takes one mistake or one breakdown in that procedure and you're potentially exposed. So it's a tragic thing that these elderly and frail people are certainly more susceptible, and they're certainly more susceptible to getting sicker. Now, granted, we have had at our hospital, I would say, 40 or so from the nursing home that were COVID positive. Some even that were there almost 2 months in a hospital bed for 2 months that we were caring for. But we are happy to say that many of those we have been able to send back to the nursing home healthy and COVID free. And that's our goal to continue, as well as all the other hospitals that are treating these same nursing home patients, is treat them to the best of our ability, give them every chance we have and they have, and send them back to home and let them continue living their lives.
Yes, there's so many things you could say about what's going on in our nursing homes. Unfortunately, it's just like anywhere. It's just like, it could happen to us at any point. If you're in an area where it's populated and it's densely populated, and nursing homes they are full, and their residents live there 24/7, and people are in and out. Workers are in and out, and unfortunately, that's how this has begun in the nursing homes. It was more than likely a worker or someone who was either didn't have symptoms or did and went to work, and it was passed. But we have had, I don't know the specific numbers. I know the last week when I was at work, they said there were up to 42 positives at the nursing home here in Dadeville, and we have had I'm not sure the number of residents from there that we have taken in and cared for. Our hospital has a floor that is completely dedicated to COVID positive patients. We have anywhere from, I would say 19 to 25 active COVID patients now. When I left Wednesday, I think there were 22. And we have actually converted a whole nother hall of the hospital, which used to be our administration hall, into another unit that can house 12 more beds. Because unfortunately, this is not something that we will see come to an end anytime soon. And we're just trying to provide places for these patients to go and be treated and get well. With Heath, we have released several patients back to the nursing home, and they have done well, and they have, they're COVID free. Unfortunately, there's other situations too where we've had some deaths, but for the most part, most of these patients can do well if they're treated and, receive the care that they need and get back to their normal. And so I'm not that really sure about the VA home in Elliott City or Chapman's. I know it's kind of similar to the situation here at our nursing home. So it's been a really large number of patients and staff members that are positive, but we're also taking patients from Chapman's and Dadeville Healthcare, Lafayette Extended Care, Roanoke. There's a nursing home in Roanoke. Greenville Hospital's contacted us. We're receiving patients from all over, but mostly in our county. And we are trying to care for those patients every day and get them well.
Yeah. And the last question was, do you disinfect items like from the grocery store? I know Laura had touched on that already, and we don't. It goes back to the hand cleaning thing. Sure, you see the supermarkets, grocery stores, they're doing everything they can to disinfect buggies, having wipes available if they're there. So they're doing everything they can do as well to try to keep us safe. We certainly appreciate that. We go in, we get our buggy, we do our shopping, we pay, and we're cognizant of not touching our face while we're in there, not touching anything that we really don't need, getting our things and getting out and getting home. We'll put them up, we'll wash our hands, and that's it. I do know some people. Actually, I know a person who was positive, who was quite sick, got well, home, doing fine now. He said he disinfects everything that comes in his house.
he does.
You know, I understand. He was extremely sick, as well as some of his family members. But we're not there. We're not seeing that, and I think the recent CDC information that's come out has shown that surface areas are not as potentially infectious as we initially thought they were. Certainly, the virus can live on different surfaces for many, many days. That's been proven. But with a virus, there's a thing called, I guess, infectability. You have to have a certain amount of that virus. Say if you had 5 soccer balls, and it took 5 soccer balls for me to be infectious. So I touch this surface in the grocery store, but I only leave 3 soccer balls on that surface. Well, even though there's still soccer balls there, /COVID, it's not enough to be infective. So we get home, we wash our hands, and we go about our business. We try not to overdo it here. Now, our work clothes, both she and I, we do not come in the house, with our work clothes, because we are in contact with it at least 12 hours a day, sometimes much more than that. So we're very cognizant of that, very clean there. But a grocery store, a convenience store, nothing. Go in, come out, pump your gas, do what you need to do. Got some hand cleaner, wipe your hands, wash your hands with that stuff before you touch in your keys, your doorknobs, and everything, and you'll be just fine.
Well, we hope this has helped. We hope that this is something that you guys can take and use in any situation that you may come in contact with what's going on. We certainly hope that this gets better and better and better, and we can all get back to normal. I know I miss my church family very much, and I know everybody else does too, but we want to be very safe and very, particular in how things progress and how we move back to our normal. But anyway, if you have any questions, don't hesitate. Heath and I would be glad to help. If we don't know the answer, we can try to find it. But hopefully this can help everybody to understand things a little bit better, and especially with what's going on. And I guess we will talk to you guys later.
Yeah, see you later.